my name's Melissa and today we're going to be administering blood transfusion. So first off, I'm going to go ahead and verify the physician order, make sure it is in the system, make sure the patient has signed a consent and that we have it on file. Next, I want to go ahead and gather my equipment, which is 250 mLs of normal saline. I have my white port, I have my red blood cells, and I want to make sure I administer the red blood cells as soon as it's out of the blood bank and no longer than 4 hours that it's out. My gloves, the alcohol prep. So now I'm going to go to the patient's room. Hey, Mr. Sandberg, my name is Melissa. Today I'm going to be administering the blood transfusion. So did the physician talk to you and tell you about the blood transfusion? Okay, cool. Have you had a blood transfusion in the past? You have. Have you had any reaction to it in the past? No? Okay, so you know the whole process, how it goes? Okay, so the reason why we're giving you the red blood cells is because your red blood cell count was low. So before I start getting everything ready, I'm going to go ahead and connect you to the monitor, get you those cardiac leads on, get a blood pressure cuff, and I'm also going to listen for your lung sounds. Can you take a deep breath in? Another one? Another one? Another one? Another one? One more. Alright, all clear. Now that I have your vital signs, I'm going to go ahead and record them real quick. And I'm going to get another nurse to come help me verify and confirm the red blood cell that you're going to get. Mrs. Sandberg, this is Kevin. He's going to help me verify the blood. Alright, so we have expiration date 5/25/2021, type B, RH negative.
Expiration date 5/25/2021, type B, RH negative.
Okay, can I have your wristband for your ID band?
SANDBERGMARK, Sandberg Mark. Blood bank ID 78923. Hospital number 1234568. Date of birth 10/25/1990.
Alright, everything's confirmed and everything's correct. Thank you, Mr. Kevin. So now, Mr. Sandberg, I'm going to go ahead and wash my hands, put some gloves on, and get the equipment ready so we could give you that transfusion, okay? Alright, so I'm going to go ahead and open all my equipment. I'm going to make sure I keep these caps on my equipment to keep it sterile. Make sure the expiration date is good, the clarity of the normal setting is okay. And same thing with the blood, so there's no bacterial growth. Now that I have my white port, I want to make sure all my clamps are closed and leave the caps off to maintain them sterile. Alright, so I'm going to remove the cap to 1 that's going into my normal saline. Remove this cap from the normal saline bag and insert it. Now that I've inserted, I'm going to go ahead and flip it. Open my port. Hang my bag into the IV pole. Make sure I prime on my tubing for the chamber halfway. And only normal setting is compatible with the blood. If other medications need to be given during this blood transfusion, I would make sure I have another line for that. So I'm gonna keep my port here to keep it sterile while I connect my blood. Remove the cap, insert it. Hang my blood. Now that I've hanged everything, I'm gonna go ahead and get the alcohol prep. Clean the extension set that I'm about to connect to. Remove that cap. Connect it. And I'm gonna set my infusion rate at 50 mL per hour for the first 15 minutes. Now I'm gonna stay next to my patient throughout those 15 minutes to see if he has any reactions. So Mr. Sandberg, please let me know if you're having any back, chest, or muscle pain, chills, fever, itching, any difficulty breathing, flushing, and anxiety. So while the 15 minutes are running and the infusion rate is going, I'm gonna go ahead and document that the transfusion has been given. Once 15 minutes pass by, I'm going to go ahead and cycle another blood pressure on my patient, make sure the cardiac leads are still on, and I'm going to go ahead and listen for breath sounds one more time. You take a deep breath in, another one, another one, another one, another one, and one more. Good. Any discomfort, itchiness, weird feeling, Mr. Sandberg? No? Okay, now I'm gonna go ahead and pump the infusion rate, increase it to 125 mL per hour, and I'm gonna assess my patient every 30 minutes. And that's it.